Caitlyn. I'm a physio with 7 years experience in the public and private sectors. I've encountered lymphedema patients at every stage of the condition, from the acute prevention of the disease to chronic management. Lymphedema is swelling due to failure of the lymph system to clear fluid. Commonly this is after injury to the lymph system following surgery or radiotherapy. Often the injury occurs close to the trunk, such as the armpit or the groin, and then over a period of time fluid builds up in limbs like the arm or the leg. Current lymphedema management is two-part. In the early phases, it's about prevention of the build-up of fluid or development of the disease. In the later stages, it's about managing swelling. This might include massage, breathing techniques, active movement, and elevation techniques. Compression garments are often used in the later phases. Typically, these are garments that are on an arm or a leg that are providing compression to try and free fluid from the area. The best management for lymphedema is prevention. Prevention of fluid buildup into the limbs prior to the lymph system becoming overloaded. Best management of lymphedema is prevention. This involves prevention of fluid building up prior to becoming accumulation of fluid in the limbs like the arm or the leg. For this reason, many of the techniques are based on clearing the proximal areas like the armpit or the groin area prior to swelling building up in the limb. Compression garments can be useful to promote normal vessel regrowth to clear fluid. This is typically used in the later stages of the disease once fluid has built up. So the compression garments are typically used in limbs like arms or legs. The best management for lymphedema is prevention. For this reason, massage techniques are aimed around clearing the fluid from the closer areas to the trunk, like the groin or the armpit, and then clearing fluid from the arm or the leg or the outside areas from there. Traditionally, compression garments are fitted to the distal areas, so the arm or the leg, but compression garments are now being designed to fit more proximal areas like the groin or the armpit. A recent randomized control trial in Poland showed that proximal compression garments of the groin and the armpit helped to improve lymphedema symptoms, prevent buildup of fluid, and helped with pain related to lymphedema. A recent randomized control trial conducted in Poland showed that proximal compression garments, such as in the armpit, helped to reduce the symptoms of lymphedema, including the fluid buildup and pain for the patients. This trial was conducted on patients post-mastectomy with lymphedema and was conducted over a 7-month period, wearing the proximal garment. The bubble wear garment is designed to be worn in proximal areas to target the proximal lymph drainage. Bubble wear aims to create a differential pressure, and the bubble design is thought to prevent lymphatic stasis. In a similar method to manual massage techniques, the bubble designs movement on the skin during normal wear. In a similar method to manual massage techniques, the movement of the bubble design on the skin during normal wear is designed to improve lymphatic circulation. Massage techniques are useful in improving scar adhesions. In this same way, the bubble wear design can be helpful in managing scars. Rapid relapse can occur if the condition is not managed appropriately. Therefore, it's vital that a garment is practical and comfortable so that it can be worn continuously. In trialling and testing the bubble wear product, I used the product myself in my own bra and unintentionally wore it the whole day because I forgot that I was wearing the product. It was quite comfortable. I've encountered individuals with lymphedema through every stage of the condition, from the acute preventative stages to the chronic management of the condition. Lymphedema is the buildup of fluid from the failure of the lymphatic system. It commonly happens following surgery or radiotherapy that affects the lymph vessels and lymph nodes. The treatment for lymphedema currently is two-part. In the early stage, it's about prevention of the condition. In the later stages, it's about management of the swelling. This can include massage, breathing techniques, active movements, or elevation of the limb. Currently, compression garments are commonly used in lymphedema in the later stages once fluid has built up in the peripheral area, so in arms or legs. These garments are designed to provide compression into the arm or leg to try and get rid of the fluid in that area. but unfortunately these garments are required to be worn all of the time to prevent relapse of the condition. In the same way, there's a new focus on garments that are designed to address the blockage or the build-up in those proximal cloister areas prior to it becoming a problem and the fluid building up into the limb or the peripheral areas. Decrease the symptoms of lymphedema, including the fluid that was building up and the pain suffered by lymphedema. The bubble wear is designed as a proximal garment. It's designed to create a differential pressure. The bubble design moving against the skin during normal wear is designed to increase the circulation of the lymph system to clear the lymph in that proximal area. Theoretically, in the same way that massage targets the proximal areas to clear the fluid, to prevent the buildup of fluid, similar to massage, the bubble design moving onto the skin during normal wear is designed to improve the lymphatic circulation to clear the proximal areas. So in the trialling and testing of the bubble wear product, I wore a bra insert in my bra, and I actually forgot that I was wearing it and unintentionally wore the product for an entire day at work without realising. In order to correctly manage lymphedema, garments need to be worn continuously. For that reason, it's important that the garment is comfortable and practical to be worn all of the time. To correctly manage lymphedema and prevent rapid relapse, a garment has to be worn all of the time. For this reason, the garment needs to be practical and comfortable to wear all of the time. Massage is a common technique for scarring. The act of moving the tissue can help to prevent adhesions in scar formation and improve the appearance of scar tissue. Such techniques are commonly used in the management of scar tissue. The manual friction from massage can help with scar appearance and with the prevention of adhesions forming in scars. In the same way, the bubble wear design moving on the skin creates a massage effect and can work in it creates a massage effect and can help in the appearance and the adhesions of scar tissue. Lymphedema is swelling due to failure of the lymph system. Commonly this occurs following surgery or radiotherapy where the lymph nodes are removed or damaged. Fluid can start to build up in the areas closer to the body, like the trunk and groin, and then over a period of up to years, fluid can accumulate in the arms or legs. Current lymphedema management is two-part. In the acute phases, it's about prevention of the condition. Current lymphedema management is two-part. In the early phases, it's about prevention, and in the later stages, it's about the management of swelling. In the later stages, management techniques include massage, breathing techniques, active movement and elevation. Compression garments are traditionally used in these later stages, and they're normally on the arm or the leg in the peripheral areas where the swelling has built up and now gathered. The best management of lymphedema is prevention of the buildup of fluid. The best management of lymphedema is prevention. For this reason, massage techniques are aimed around trying to prevent the fluid buildup by managing the areas closer to the body and clearing fluid from these areas before it builds up into the limbs like the arm or the leg. Traditional compression garments are typically built to compress the arm or the leg or peripheral areas once fluid has accumulated. But compression garments are now being designed to fit the proximal area to prevent fluid from building up. Traditional garments are compression garments that are targeted at the peripheral areas once fluid has built up, like in the arm or the leg. Traditional compression garments are aimed to compress the arm or leg to address fluid once it has built up in the limb. Traditional garments are compression garments that are designed to fit an arm or a leg to get rid of fluid once it's built up in those peripheral areas. Theoretically, we want to prevent fluid building up in these areas, so if we can target the areas closer to the body and prevent the fluid gathering there, this is going to be more successful. A recent randomized control trial conducted in Poland showed that a proximal compression garment helped with the symptoms of lymphedema. A recent randomized control trial conducted in Poland showed that proximal garments helped with lymphedema, addressing the buildup of fluid and pain in these patients. This was conducted over a 7-month period in patients following mastectomy and lymph node removal. Bubble wear garments are designed to be worn in these proximal areas. They're designed to create a differential pressure The bubble design is thought to prevent lymphatic stasis. In a similar method to manual massage techniques, the design of bubbleware moving against the skin during normal movement is thought to improve the lymphatic circulation. The bubbleware garment can also be used with scar tissue adherence. In the same way that massage is used to decrease scar tissue adhesions, the bubbleware design movement on the skin can be helpful in scarring. Rapid relapse can occur if lymphedema is not managed correctly. For this reason, garments must be designed to be comfortable and practical to be worn all the time. When trialling out the bubbleware garment, in the process of trialling and testing the bubbleware garment, I used the bra insert myself, and I actually forgot that I was wearing it for an entire day because it was quite comfortable.